Hey friends, it's Dr. Jamie. We are calling this segment Ask the Gynecologist. So I went to Instagram and I put some feelers out there and I said, ask me anything as an OBGYN. I actually have not looked through these questions. I'm going to go through them completely live and I'm going to pick some of the best ones to go ahead and answer here on YouTube. Okay, so our first question, I won't even read names. Okay, this is completely anonymous. But the first question is, do you recommend shaving the entire bikini area? I get severe razor burns. Suggestions. So we just shot a really cool video here in the office about your first gynecology visit. And one thing I didn't bring up is hair removal. People always ask about this. So first of all, as your gynecologist, we see everything and really honestly, we don't care. It is your personal preference if you choose to remove your hair, if you choose how to remove it. But let me talk just a little bit about the pros and cons of different hair removal methods. So one thing we frequently encounter with razor hair removal by actually shaving the area is that people don't change the razors often enough and the razors get very dull. And this is of course an area that is very prone to bacteria. So that can lead to a condition called folliculitis, where you get little red bumps. They might itch or burn, or sometimes they can get infected. So be super careful if you're performing razor hair removal by shaving that you're frequently changing the razor. Other forms of hair removal are things like waxing or more permanent things like laser hair removal, which are a little bit better just because they don't have any physical trauma on the skin or to the hair follicle. They actually pull out the entire hair follicle. Now with waxing, you can also get infections. You can also get dermatitis and irritation of the skin due to the hot wax. So just know that there's pros and cons to all of those things and choose what's best for you. But as your gynecologist, we really don't care. We care about you. All right, let's see. What other ones do we have? Somebody's asking about birth control. We actually have an amazing video that is coming out, so you can go ahead and look for that other video on birth control where I went through all the different types of birth control and the pros and cons to all of those. So go ahead and check that out. Let's see. Somebody says, what is the best and the hardest thing about being an OBGYN? So I would say the best thing is that we actually get to practice in a happy area of medicine. I think delivering a human life is the most rewarding thing on this entire earth. With that being said, doing obstetrics can also be one of the hardest things we ever have to do, because to tell a woman that she has lost her baby or that there is something wrong with her baby is literally one of the hardest things that we ever encounter. And luckily it's not that common, but when it does happen, we cry with our patients. We lay in bed at night thinking about those patients. Those patients really carry a very special, part of our heart, because we just can never imagine being on the other side of that. The other worst part of my job is telling patients that they have cancer. But luckily, the most common cancer that we encounter is endometrial cancer, which has some of the highest cure rates amongst female reproductive cancers if they're caught early. But I would probably say that's the best and the worst things. 3 a.m. deliveries get pretty old. I won't lie, but delivering babies is definitely the best. Definitely the best. Okay, somebody's asking, is vaginal discharge normal? And the answer to that is yes. The vagina is a self-cleansing organ. So you have all of these glands inside the vagina. You have progesterone that's making cervical mucus. You have glands that lubricate the opening of the vagina, and that creates vaginal discharge. So everybody makes differing amounts. There is also bacteria that is normally found in the vagina. It's called lactobacillus. I actually did an entire video on keto crotch if you want to go find it. But this lactobacillus makes lactic acid, which keeps the pH of the vagina very low. This is how the vagina is able to fight off against other pathogens, but there is a normal microbiome that lives in the vagina. If that microbiome gets off, your vaginal discharge might change. It might change in color or in odor. And of course, you can always acquire sexually transmitted infections and diseases. So if you feel like your vaginal discharge is different than normal, make sure you talk to your provider about getting testing, because there really could be something wrong. But I think that women in our society have been made to believe that the vagina doesn't make any discharge, and that it's supposed to not have any sort of smell, but there are bacteria that live in there, and it has a very normal amount of discharge and a normal smell to it. So That's a fantastic, fantastic question. Let's see, what other good ones do we have? So somebody's asking about a multivitamin recommendation. So I don't recommend multivitamins just across the board for everybody. I think that supplementation should be for a very specific purpose and for a very specific duration of time. I think that your food actually has the most bioavailable nutrients. So for my patients, my recommendation is to really eat a nutrient-dense diet to get all of those things that you are absolutely needing. Okay, let's see. Oh, this is a great question. Somebody is asking if annual examinations are still needed after a hysterectomy. I still have my ovaries. And the answer to that is yes. We recommend a yearly breast examination and a yearly pelvic examination, regardless if you've had a hysterectomy, especially if you still have your ovaries, because we want to be screening for symptoms of ovarian cancer. And we, of course, always want to be performing that yearly breast examination. We're also screening you annually for other diseases. The two most things that are most likely to kill you or make your life miserable are things like cancer and cardiovascular disease. So we are screening for lots of things during that annual examination. Now, you might be specifically, I think what I'm reading into your question is, do you need a pelvic examination if you've had a hysterectomy? And the answer to that is also yes, because you can get especially if your hysterectomy was for HPV-related precancer or cervical cancer, that's 100% yes to that. But you also have, tissue in the vagina and the vulva that you're not normally looking at on a routine basis, and we may see things that could be concerning. We're also screening for things like urinary incontinence or pain with intercourse, and an examination can be important for those things too. So that is a fantastic question. Thank you guys so much for that.
It was at this moment that the mother lion used one of its most infamous tactics due to unwanted noise being made from her cubs. The rarely documented mother's stare, a brief but effective form of authority, is one of nature's most feared creations.
That's how you parent. Okay, a great question here, an obstetrical question. And the question is it difficult for doctors to deliver babies when moms choose an atypical birthing position? And I love this question because we actually have midwives that practice here in our clinic, and they kind of joke that I'm a midwife trapped in a doctor's body. So I allow patients to labor in whatever position feels most comfortable to them and whatever is safest for them and their baby. And so I find that most women without an epidural, actually the traditional birthing position, which is called dorsal lithotomy, which is when the woman is on her back with her hips in a flexed position, actually doesn't tend to be the most comfortable. Typically positions where the mother is turned over like on all fours or in a squatting position tend to be more comfortable. And I allow patients to deliver, once again, in whichever way they feel most comfortable. Now, your question was, is it difficult to deliver babies that way? The answer to that can be yes. If you're not physically fit enough to be squatting down on the floor with the patient, or to be crawling up onto the bed in a weird position, from an ergonomical perspective, yeah, it can be difficult. And so not all providers will offer these types of things. The majority of patients do get epidurals, in which case positioning is very limited because they don't have use very much of their lower extremities. But we can also do different positioning with an epidural. You just need a really good labor and delivery nurse and a cooperative patient. But I encourage all different birthing positions because as you move around, it changes the shape of the pelvis. It allows the baby to navigate the pelvis. Sometimes if things are kind of getting stuck, it's best to change positions every so often. So I really encourage moms to move around in labor. A traditional hospital room, it's funny, when you walk in, you see the bed sitting there and people think that they should just go in and lay in the bed until the baby comes out. But I actually wish the bed wasn't there, except for when you needed it for rest. So that is a great question. Thank you for asking that. Okay, all right, let's see. Let's see here. We have lots of questions that are very specific to people's medical conditions, and I really want to make sure that these are generalized to help the most people. So don't be offended if I'm not answering your question, but I just want these to be super generalizable. Somebody asked how often we're really supposed to be going in for pap smears. So everybody probably saw my post recently about the controversy with pap smears. So traditional pap smear screening was performed annually on an annual basis, which was super easy to remember because we just performed it every time you came in for your annual examination. Then we started to discover that HPV, or human papillomavirus, was one of the major drivers of cervical cancer. So we started screening for that too. Once we found out a lot about HPV, it was able to help us extend our screening guidelines, meaning your doctor could now start performing screening every 3 to 5 years based on your personal history and personal risk factors. Unfortunately, now the pendulum has swung so far that some organizations are only recommending screening for HPV, and they are looking at dropping the pap smear completely. In 2020, right now, as an OBGYN, I don't recommend that to happen based on current data. There are non-HPV related cervical cancers, and there are reasons to perform the pap smear. With the current data, we would miss a lot of cervical cancers, and it's not worth losing one patient for that for me. Pap smear is a super cheap test, it's an easy test, and patients are already getting a pelvic examination. So talk to your doctor about what's right for you and how often you want the test performed, and I hope that we can continue to make cervical cancer less likely in the United States. We're so good at screening for it. Across the world, cervical cancer is the most common GYN cancer, but in the US, we're really good at screening for it. So continue to see your doctor on an annual basis. And if you want your pap smear annually, talk to your provider to see if they're willing to do that. Okay, so somebody says, is it normal to have vaginal pain during sex? Is there something for a sensitive vagina? So pain with intercourse is not normal. So talk to your doctor about getting an examination, figuring that out. I find a common condition that patients will sometimes suffer with is something called vaginismus, which is actually contractions of the pelvic floor. And in this case, I send them to a pelvic floor physical therapist. So if you didn't know, there's actually physical therapists that specifically work with the pelvic floor in women. And it's also related to your core. Your core and your pelvic floor are related. And there are lots of modalities that can really help. So talk to your doctor if seeing maybe a pelvic floor physical therapist might be helpful. But there's lots of other conditions that should probably be investigated here because that is not normal.
Sorry.
Okay, moving on. You guys are asking some really good questions. I think we're going to have multiple videos with the Ask a Gynecologist. So somebody's asking about telling good stories about delivering babies. I think some of the best ones are the people who come in and didn't know they were pregnant. You know, you see it on TV, you wonder if it's real. Sometimes even as providers, we wonder if it's real, but it has certainly happened to almost every OBGYN, and those are some of the greatest stories. Okay, somebody is asking, are bioidentical hormones okay? So hormone replacement therapy should probably be its own video. We should do an entire video on this. But one of the common misconceptions about bioidentical hormones is that people think if it's a prescription hormone that it's not bioidentical and that these are something more natural. We have synthetic hormones and bioidentical, but some prescription hormone replacement therapy is indeed bioidentical. So anything that contains 17-beta estradiol, estrione, or micronized progesterone is considered bioidentical. Synthetic forms of both estrogen and progestins may come in prescription form, they may come in compounded form, and there's of course a lot of controversy if one works better than the other. I think where most of the controversy lies is with compounded bioidenticals, because you really have to be trusting your compound pharmacist that they're mixing up the concoction in the right strength and the right dosages. Of course, things that you get from the pharmacy go through FDA regulation as far as dosages and quality control and what's actually contained in them. I am a fan of hormone replacement therapy for the right patients. And once again, we should have a whole video on hormone replacement therapy, and I've done lots of podcasts on this, so go catch those too. Okay, let's see. So many questions. Somebody is asking if I'm still using a 24-hour glucose monitor. I don't know if we can see this in the shot, but I actually have a new glucose monitor on. This is the Dexcom G6. This is the first time actually trying this particular glucose monitor. I've used the Freestyle Libre in the past, and so, oh, it's yelling at me because I touched it. I have definitely gained some information. I think pros and cons to the different ones, and so I would love to do a review, but yes, I'm currently using it. And I think continuous glucose monitoring is so valuable, even if patients wear it for just a short amount of time, to see how their body responds to different foods, to stress, to sleep, to training, because there's so many different things that can affect our glucose levels. And that is definitely one way to keep yourself healthy, is to keep your blood glucose levels in check. All right, let's see. Somebody's asking if I drink caffeine, why or why not? So I only use caffeine for very specific purposes, and that's when I feel like I really need it, either for physical or mental performance. Caffeine is, of course, a highly abused substance in our society, and we're so stress-driven, we're so driven in the sympathetic nervous system that I think that it can be harmful for some people. Also, caffeine has to be metabolized in our liver. So if you're slow at metabolizing something like estrogen, then drinking a lot of caffeine actually could be harmful. It also is really messing up people's circadian rhythms. And I find that things like pre-workouts, energy drinks are highly dosed in caffeine. I mean, we're talking patients that are consuming upwards of 300 to 1,000 milligrams per day of caffeine. So know why you put everything inside your body. Every single thing that you put inside your mouth or that you drink, you should be doing that for a very specific purpose, and that's to make yourself a better version of yourself. But it's definitely can be overdone. Just like any U-shaped curve, just make sure you don't oversteer. Also, with use of caffeine, you need more and more and more of it for the same effect. So if you do use it, it's good to have washout periods of time where you don't use it at all to kind of reset your system a little bit. That's a good question. Let's see. Somebody's asking about CBD oil for period cramps. So CBD oil is actually comes from the hemp plant, and it's not psychotropic like forms of marijuana or THC. And we are starting to see pretty good research actually in the areas of insomnia, anxiety, and pain, especially chronic pain, chronic pelvic pain. And so for this purpose, I don't have an issue if patients want to try it. The way that CBD works actually is it helps upregulate something called anandamide. We actually make our own anandamide, but the CBD helps us kind of keep the anandamide around for a little bit longer in the places that it needs to be. And it doesn't work for every patient. So just as an example, I had some genetic testing done that shows that I don't make high anandamide levels. And so CBD, I've actually tried it for sleep. I think it works great for me, but I've had patients try it and with no difference at all. But basically, those are the three biggest indications that I'm currently seeing in the literature, is with insomnia, anxiety, and with pain. So talk to your provider if it might be right for you. The biggest problem with CBD is just sourcing or knowing what the concentration is of a tincture that you might be taking. So that's the hardest part currently with CBD production. Okay, let's see. We're going to do one last question here. Okay, this is a great one, and this is a common one that I get in my clinic as a gynecologist. Somebody says incontinence solutions. They're 43 and they've had 3 babies. Ladies, please listen. Please turn up the volume on this video. It is not normal to lose urine. It is not normal to pee your pants. This is not like the Adam Sandler video where like you're not cool unless you pee your pants. A lot of women just think that it's a natural part of the aging process, that it's just like, you know, something that comes with time with having babies, that it's just like a rite of passage or something like that. It's not normal. And so talk to your doctor, because there are lots of different modalities that could help. The first one being pelvic floor physical therapy. Sometimes we can get great response with that. Sometimes other things in your life that might be contributing, like the amount of caffeine, liquids, your diet, your weight, your exercise. And then of course there are surgical options that can actually be very effective at helping people with incontinence. And there's different types of incontinence. The one that you're describing from having babies is something called stress incontinence. There's also something called overactive bladder, and you need to understand which one it is. So see your provider, do the testing, do the examination, and figure out what's going to treat you the best. But in general, yes, we have treatment options for that, and it is absolutely not normal. So I hope you guys enjoyed this Q&A on Ask the Gynecologist, Ask the OBGYN. I said you could ask me anything, and I'll always be open and honest with you. So if you have any questions or comments, make sure you leave them below. Share this video. I'm sure there was information in here that somebody you know is going to enjoy. Make sure you subscribe to our channel so that you can see our future videos. Have a great day.